Of all the topics that I cover on this podcast, the one that makes men most squeamish is talking about the performance of their manhood, especially in the bedroom. The fascination with how long it is, how hard it is, and how long it lasts brings up a tremendous amount of anxiety for most guys. And as we age, things can become even more challenging as we add prostate issues to the list. Now, there's lots of information and gadgets out there, ranging from ancient herbal remedies and various surgeries. So, what is a man to do? Well, today my guest is a renowned urologist. He's going to share with us his wisdom on what we can do to strengthen our manhood. Now, before we get into all that, we know that being a man today has never been more challenging. And so the pain we feel for many of us is real. It's a pain of loneliness, and it's a pain of unworthiness, and it's masked by our anger and our resentment. And it's all because we were uncertain and afraid to take that next step. So if you're tired and fed up with where your life is at, then I'm going to encourage you to start your hero's quest, where you can become more, accomplish more, and live more than ever before. Just go to members.theawakenedman.net and start your quest today. And with that, let's get on with today's episode.
The average man today is sleepwalking through life, many never reaching their true potential, let alone ever crossing the finish line to living a purposeful life. Yet, the hunger still exists, albeit buried amidst his cluttered mind, misguided beliefs, and values that no longer serve him. It's time to align yourself for greatness. It's time to become a revolutionary man. Stay strong, my brother.
Welcome, everyone, to the Revolutionary Man podcast. I'm the founder of the Awakened Man movement and your host, Alain Dumonceaux. Before we get started, let me ask you a couple of questions. What is your biggest fear entering the bedroom? And with that fear in mind, how well do you perform in overcoming that fear? For many of us, that's how we start the journey. It's in fear, especially if we have faltered in the past. And will it happen again? What will she think? Do I even want to go there? These are all valid questions, and yet they keep us locked into this mental gymnastics game whose only goal is to keep you stuck and feeling sorry for yourself. So how do you go about shifting that narrative and start performing the way you once did? Well, I'm sure my guest today will have lots of ideas for us to consider. So with that, allow me to introduce my guest. Dr. Gittens is one of the country's leading specialists in sexual function for men and women, hormone replacement, male infertility, and wellness. He is a board-certified urologist, fellowship trained specifically in sexual medicine and male infertility. And for men with erectile dysfunction, he focuses on allowing them to regain their natural erections and not just treating the symptoms. He also specializes in treating low testosterone, chronic testicular pain, Peyronie's disease, premature ejaculation, and penile rehabilitation after radical prostatectomy and radiation therapy. He also treats men with a history of anabolic steroid use that has problems with infertility and decreased libido and sexual function. Gentlemen, there's nothing we're not going to touch today. Welcome to the show, Dr. Gittens. How are things, my friend?
Things are great. Thanks for having me. I love the intro, how guys they want to have harder erections. They want to last longer, right? And be more confident. And hopefully we can touch upon a lot of things today, a lot of things tonight that your listeners would, take home and hopefully they can use some of the things that we talk about to be better in the bed and be better in the bed.
Yeah, absolutely. And just with having that self-confidence to be able to really have us be able to show up the way we'd like to. Now, in our work here with the Awakened Man and on the Revolutionary Man podcast, we always talk about everybody being on a hero's quest, and kind of that's what we're going to be diving into today. But so tell us a little bit about yourself. How did you come to specialize in sexual medicine? And tell us a little bit about the work that you do, and how that's helping men around the world today.
Yeah, so as you mentioned, I'm a board certified urologist and fellowship trained in sexual medicine. But really what started my journey was a bunch of patient experiences that I had early on in my career where men who might have been treated for prostate cancer, who just had erectile difficulties or any kind of sexual dysfunction, were really being ignored. And so I thought it was a space where I really enjoyed talking to men and treating these men, and then it evolved to where I am today, actually, in my centers here in Philadelphia, New York, and in Allentown, Pennsylvania.
Right on. It's interesting that you mentioned that in your experience about how men were being ignored with this challenge that they're facing. Why do you think that is? Is there something within the industry that's causing that, or what's going on about that part?
Well, when I think about my training, and this goes back, I mean, it goes back probably about 10, 15 years now. We were really focused as urologists just on treating prostate cancer, enlarged prostate, and we either didn't have the education to really talk about sexual function, or a lot of urologists and a lot of physicians were just unequipped and maybe a little bit embarrassed to talk about sexual function. So if you're not comfortable talking about it, or you're not comfortable with the topic, then you're not going to talk about it with your patients. And so during that time, I found that was the case. And for me, I loved reaching out to my patients and helping them, especially with their sexual function. And then I decided to kind of move on and do a fellowship and then open up my centers here at Rockwell.
Yeah, and that's great. It's really, really interesting. I was taking some notes. You'll find I'll do that a lot during these interviews. And one of the things I jotted down was just that people may be embarrassed. And even as a professional working in the medical field, and it's interesting how, and I'll say that society has really drilled that in for us, hasn't it? It's not something that for men that we're comfortable to talk about. Yeah, sure. When we were young, we would tease each other and kid each other and poke fun at each other. But as we got older, those types of conversations just didn't happen anymore. And so to hear that even from a profession, a medical profession, that could be something that'd be uncomfortable for the patient as well as a doctor. And so my next question for you is, with us as men finding it difficult for us to really seek help for these sexual health issues, and it might become part of a stigma around asking for that. What advice do you have for those men to overcome those barriers and encourage them to have more open conversation?
Well, I think at first you have to realize that you really have the problem, right? And that, a lot of guys try to ignore the problem. They say, it might be their partner, it might be just the situation because, I'm tired or I'm stressed. So I think the first thing in recognizing that you really have a problem. And then after that, it's reaching out to loved ones or your partner and maybe talking about it with them. And then after that, finding a clinician that is focused on this area, that has a track record of treating patients for sexual difficulties. And then, and then with that clinician kind of moving over into treatment and other alternatives, things to do to kind of help with sexual function.
Absolutely. And do you work alongside with your practice? I mean, anybody with like a sex therapist to help them? Because there's also that, I think you were kind of really alluding to, sometimes it's that mental game, right?
Yeah,
And
yeah.
that can also play a part in it. What kind of work do you do with that?
Yeah, adrenaline plays a big role into erectile function and sexual function. If you're anxious, if you failed a number of times, then what's going to happen is you're going to make more adrenaline, and then that adrenaline then puts your body into this fight or flight response, and then blood flow is going to leave your genitalia, your penis, and it's going to be much harder for you to have an erection. So the answer to your question is yes, we work hand in hand with specialists. I have a number of specialists that I work with, in the country as well as in the Northeast.
And I think that's a holistic way to look at that, right? There's the physical side of it, but there's also that mental aspect of it. And we start to combine these things and understanding the science behind it. And so this is the first time that I've really starting to get a bit of a picture about the effect of adrenaline has, the negative effect it really has for us. And so that's interesting how that comes together and how we have that challenge in making things work for us.
Yeah, definitely. I mean, yeah, adrenaline it's adaptive, right? And so it works when you are trying to run or you're trying to fight, right? I mean, you want the blood flow to leave the genitalia and areas where it's not needed and go to those muscles like your arms and your legs. But when it comes to sexual function, it's just you're at a disadvantage when that happens for a number of reasons. Your heart starts to beat really fast. Think of a person, if they're like, what I like to think of is like a person that's scared of heights or something. As you get closer or you go higher and higher up the ladder, your heart starts to beat a little bit harder and you get more and more nervous. And it's the same thing. It's when you failed, when you're getting intimate and you're getting close to that point of maximum intimacy, your heart starts to beat a little faster because you're thinking, oh, am I going to fail again? Right? Yeah. Am I going to fall off this boat? This boat is going to sink right now. And so how do I get off? Right? And so we have to be able to, as clinicians like myself, is to be able to treat that medically, but also with, some psychiatrists that we use or psychologists that we use, we can help kind of with that adrenaline response. And just to mention what you mentioned before about how clinicians, some clinicians might not be comfortable. You have to think of clinicians as we're real people, right? We live like in the world with everyone else. I mean, I have the honor of being a physician and treating people, but it's one of those things is we put a white coat on and we're still the same people. And so there are physicians that, they just don't feel comfortable in their everyday life with sexual function. So when they put on that white coat, it's not gonna change their ideas about sex or how they feel about sex or their comfortability with sex.
Yeah, that's a great point. Absolutely. Because we do have this idea, right? We look at that white lab coat and we sit there and think that, okay, they know everything. And you would have that was my, unconscious bias happening there, forgetting that there's a person underneath that jacket that may also have other things going on for them. So I appreciate, bringing that clarity there. That's great. Really, we're talking about erectile dysfunction so far, right? And there's lots of different treatment methods. I noticed that at your work, you have several different things and ways that you help men with this. How do you best go and describe or get it onto the best course of action, I should say, to help an individual?
Yeah, I mean, I think the first thing and the most important thing is kind of sitting down like you and I are sitting down right here, right? We're having a conversation. That is the most important thing. I mean, I do, a bunch of lab tests and I do nerve testing, I do ultrasounds, but it's really when you sit down and you talk and you go through the experiences with the patient, you understand what they're going through, right? That is like one of the biggest things I think. And obviously, looking at their medications and looking at their medical history, do they have diabetes? Do they have hypertension? Looking at if there's been a history of sexual abuse, there's so many things that we talk about in our consultation. But the most important thing is like sitting down and really getting to know the patient and knowing their story, I think is, that's probably like 80%. And then the next 20% is going to be, as I mentioned before, looking at their meds, looking at all these other things. We do hormonal testing, we do metabolic testing. We're doing nerve testing for their erections and their sensitivity. We do Doppler testing, which looks at their vasculature. Do they have an issue with leakage, or do they have a problem with getting blood flow into their penis? Or is there scarring in their penis? So, we look at all these things, and all of them important, but I think the most important thing is really sitting down and talking to the patient. And I think that's where we gain a lot of our knowledge, and it allows us to treat our patients effectively.
Yeah, that makes complete sense. Before going anywhere, even starting the journey, you have to have an understanding of what the journey is all about, and what are they bringing to the table in order to start that conversation and really get a good handle and grasp on what it is that can best serve them. I'm wondering, in your practice, you've been doing this for quite a number of years now. Are you finding that these challenges with the ED for men, is it still typically like a guy my age in my 50s? Or are you seeing this happening for younger men?
So I think it's always happened in younger men, but I think there's a lot more kind of education about ED. You go on the radio and you see these online things that you can get, like tablets you can get for blood flow to the erections. I think that plays a big role. I think a lot more guys are looking at porn. Porn's more accessible, so they're looking at another guy's penis and another guy's erection, which can make them feel a little insecure. I think that a lot more younger men are trying to be more proactive about their erection function as well, because they realize that when they're 50, they can have some decline in their erectile function. So they're trying to get ahead of the game. And so I do see, obviously, in terms of the men that I see, we will see a lot more guys in their 40s, 50s, and 60s, but we definitely see guys in their 20s and 30s without a doubt. So, and I think because of those reasons. And so being proactive is one of the things that a lot of guys are trying to do to prevent them from having some erectile difficulties as they age.
For sure. Go ahead.
And then so one of the things that we recommend for guys that are trying to be proactive is something like the exerciser, which it's a hydro pump that we recommend. And I always recommend it. And guys say, when should I go on a hydro pump? Like, when should I even start to think about it? For me, I always say, all right, well, morning erections are a big deal, right? In my world. And so the reason why guys get morning erections and they get erections in the middle of the night, which they should have about six or so, if during certain parts of sleep, is to get good oxygenation to the tissues of the penis, right? Because during the day, right, our penis is contracted. It's not getting a lot of oxygenation. So our body's figured out a way to say, all right, when am I going to get the maximum amount of oxygen to the tissues so it can remain healthy? And that's in the middle of the night and that's early in the morning, right? So I always tell guys, like, if they're being proactive, I mean, they could start something like a pump at any point, but especially if they see a decline in their morning or nighttime erections, that's really, for me, that's a good time to really start using that hydro pump. So you can either use it on your own proactively, or you start using it when you see a decline in those morning and nighttime erections. That's when I like to start it.
Interesting, really interesting stuff. You brought up the topic there of porn and some of the research and other folks I've had on the podcast. I've had mixed reviews on whether or not the watching porn decreases your sexual function versus increasing it. In other words, that we get desensitized from watching porn, especially if we're watching too much of it. And so we lose the ability to be able to even get hard enough to even have sex because we have these unrealistic ideas from the things that we're watching. Do you follow what side of the coin do you fall on that?
Yeah, I think that porn can be used as a tool to help with sexual function, but like you mentioned, there's the other side of the coin. And the other side is when guys are substituting that for sex, when guys, the expectations change when it comes to sex, like they think their partner is going to enjoy like anal sex or something like that. Maybe they don't, right?
Right.
Or, depending on the type of porn, or, if what excites you and the only thing that excites you is a guy with three or four women, then you're going to be, and if you have only one partner, then you're not going to be as satisfied. So these are all the things that the negative consequences. So I think it just depends on how much you're using it, how you're using it, how long you're using it for, But, I think a little porn is perfectly fine in the right hands.
Yeah, it makes complete sense. Complete sense to me. We're leading toward the next piece I want to talk about, and that was, the other thing that guys are really concerned with, and that's, the premature ejaculation piece, right? And we want to be able to, we have this idea that, we can't go until she does. And so, what insights do you have that you can share about the causes of that and the effectiveness of us being able to have a proper treatment strategy so that we can last a little longer?
Yeah, I think so. I take care of a number of men in the porn industry, right? And, and they'll tell you like a lot of it is a lot of cutting of film and going back and retaking it, or they're using it injections. And so when we use injections, they can have intercourse, they can ejaculate, but then they can keep going, right? And so I think as a person looking at porn, they may not be seeing kind of behind the scenes like I do, right? And so they're thinking that these guys are lasting, 40, 50 minutes, which maybe some of them are, but I'll tell you that most of them aren't because I take care of a lot of guys. So I think those expectations could be unrealistic for a number of men when it comes to ejaculation. But there is something called rapid ejaculation or premature ejaculation, and it's the most common sexual dysfunction that we know of. It occurs in a number of men. And usually what we say, if for the kind of one of the definitions, is if a guy is ejaculating in less than 2 minutes or so and he's bothered by it. Those are really the two major kind of indicators of premature ejaculation. You got to be bothered by it. If a guy's ejaculating in 30 seconds and he's okay and this is the best thing in the world, and he doesn't really have premature ejaculation.
Right.
So there's a number of causes of premature ejaculation. There's guys that are too sensitive. There's guys that have history of like trauma. There's guys that have too much anxiety, right? So and it could be situational where maybe a guy who's in the back seat of his car with his partner is having some premature ejaculation, but if he's in the bedroom, he's perfectly fine, right? So that's one thing, right? So it could be lifelong as well. There's a number of different theories. There's serotonin theories. Like I said, there's sensory theories, there's psychological theories. that cause premature ejaculation. But, so there's a number of ways you treat it. You can treat it with some sprays. You can treat it with medication that can increase serotonin in the brain. There you can use hyaluronic acid in the head of the penis. So you can use filler. So that's off-label treatment for filler. You can place that in just the head of the penis. So the penis is less sensitive. There's some studies on Botox where you can use Botox for the penis as well to kind of stop the ejaculation or retard the ejaculation. And so those are the main treatments for premature ejaculation, and there's a lot of in between. So for us, when guys come in, once again, it's a history. We check labs, we do sensory testing, and then we offer a number of treatments for premature ejaculation. But we try to start with the basics first, and then we climb our way up, depending on if the primary treatments fail.
That completely makes sense, for lots of reasons. And so, it's good to hear to get that distinction as well. It's about how we feel about it and whether or not that truly is premature or not. And so it's good because I think, like I said, I think a lot of us men, we have this idea, this vision that this is how it should happen. And we just add more stress and anxiety for ourselves. And when we can let that go, I think it makes things a lot easier.
Yeah, who doesn't want, a lot of guys want to go like 30, 40, 50 minutes, and they don't want to stop. But I think, foreplay is really important, like if you talk to women, it's, obviously, guys want to have sex, women want to have sex, right? But what about kind of pre-sex? What are we doing for pre-sex? How are we leading to sex? How are we warming things up? How are we warming up the engine? And that's really important, right? We have to make sure that we're satisfying our partner, right? And in so many different ways. And so, that communication is so important. What does he or she want you to do? Is it, does she want, it's so many things, right? So important. So I think that conversation, and I think kind of being aware of your partner is really important. Not being aware of what you want, but being aware of what your partner is kind of edging you towards. And so if it's not a conversation, sometimes it's like a movement of the body, like, oh, to the left or to the right, maybe it's a higher pitched tone. These are all things that as guys we have to pay attention to when we're doing kind of that pre-sex, right? And even during sex as well. But all these things are so important that we have to pay attention to.
Yeah, it makes complete sense. I was just thinking of a conversation I had with another guest on the show a while back, and we just talked about, when you're in the bedroom, is if the first play is the genitals, it might not be your strongest play. The better play would be there are other parts of the anatomy that you can spend time with. It's all about that foreplay aspect of it. But sometimes we get into this mindset of that we just need to be a jackhammer and get after it.
Yeah,
really,
it's nothing wrong with a quickie though. Nothing wrong with a quickie.
No, every once in a while. Yeah, every once in a while.
But yeah, obviously, absolutely. We don't need to be a jackhammer. I think we have to be able to pay attention and be conscious, and it should be experience for both you and your partner. It's not just about you; it's also about your partner.
Yeah, absolutely. Let's shift a little bit. I just want to talk a little bit about low T. And that seems to be something, especially as I get older. I'm 57 now, I'll be 58 this year. And, I just think about, how testosterone levels have been changing in men overall. And so I want to get your insights on what you're seeing today, and what are some signs that if we may not be aware of, things for us to consider that maybe we have a challenge with low T and what we should do about that.
Yeah, there's a lot of these low T clinics out there, aren't there? Just everywhere, around every corner, right? And everybody's passing out testosterone like it's like water. It's crazy. I'm a big proponent of testosterone and testosterone replacement in a number of different ways. So there's ways to stimulate your own body to making testosterone. There's different ways to administer testosterone. So I'm a big proponent, but I'm a big proponent in the right person, right? And so that is the key. Right? Because if you take a guy with no symptoms, right? No, issues with no issues with libido, no issues with erectile dysfunction, no issues with energy, fatigue, whatever you have, and you give them testosterone, they're not going to feel any better, right? Because they have no symptoms. right? So you got to have symptoms. In my mind, I use testosterone as the levels is just like a gauge, right? And the gauge is all right, if you have symptoms and I give you testosterone, and if those levels are too high, then I know to kind of back it down, especially if you're symptomatically better, right? But, some guys use testosterone as they say you have to get to 1200. You got to get to 1200 or you're not getting testosterone. It's not right. I think that's totally incorrect, right? You have to think of testosterone in a couple different ways. I think of it as like, for instance, I drink coffee every now and then, right? And I'm really sensitive to coffee. So for me, if I drink like just a small amount of coffee, it lasts me throughout the day, right? And so there's some guys that just need a little bit of testosterone, right? And it's great for them. There's other guys that need to drink more coffee, right? They need to have a little bit more testosterone in their system to get them to feel symptomatically better, right? And there's some guys who their symptoms aren't related to testosterone at all, right? And they may have some fatigue and they may have some depression, and you push their testosterone up, and then you realize, listen, I pushed your testosterone up and you don't feel any better, right? So that means that we have to look at other reasons why those people are having symptoms. Do they have sleep apnea, right? Do they have depression? Do they have some of these other ailments that also can mimic the same symptoms of low testosterone, right? So you have to look at testosterone in a way where there's symptoms and there's labs, and people are more sensitive. So for some people, they come into my office and they might be coming in for something unrelated, and I check their testosterone, and maybe it's a level of like 350, right? And some people will say that's really low, or 300's low. But these guys have no symptoms. Feel great, right? They feel wonderful. Do I give that guy testosterone and get him to 850 or 1200? No, of course not. What am I gonna accomplish? Right?
Right.
Right. So you do look at the numbers to a certain degree, but you got to look at their symptoms. And then you have to look at symptom improvement after you increase their testosterone. All right. And I think that's where, in my opinion, I think that's where a lot of these testosterone clinics, they go wrong, because they just look for a number and they just try to keep people in their system, and they just keep giving them testosterone, even though these guys aren't getting any better, they're not feeling any better or what have you. Right. Because there are some side effects that we have to pay attention to, right? We know that testosterone or any hormonal therapy can increase the rate of blood clots, right? So that's one thing we have to monitor that. We also know that it does increase your hematocrit or your hemoglobin or your red blood cells, right? And so we have to be careful that we're watching that, because we don't want somebody to have a stroke or anything like that. So those are the things that we're constantly watching, and we're kind of tinkering with levels and making sure people are feeling better. We're looking at the whole picture, right? And so in general, I think testosterone is a great substitute, it's a great product, but I think you have to use it in the right person.
That makes complete sense. And throughout our whole conversation today, what I'm really taking away from what you're saying is that everything is there's no cookie cutter, hey, we're going to do this and this. The moment that you see that patient, that you're really taking that time to understand what their needs are, because there are clinics out there, and unfortunately there are other folks out there that aren't necessarily as thorough as this, and it's more of just a prescription style. And I like that you're really diving into that individual to get an entire picture about what's the best course of action for them for them to get the best results. And I think that's so key, that we need to see more of that in when we're meeting our doctors and other types of people that we go to get help.
Yeah, I mean, my job would be so much easier if I could do that. Like I put everybody on the same testosterone, everybody in the same regimen. If they're using HCG, whatever, everybody's on the same thing. And, in reality, there's some people you have to use a little bit of this. You have to use a little bit of like, maybe some estrogen blockers here, maybe a little HCG here, maybe a little Clomid here, maybe a little testosterone there. And then are you doing it once a week? Are you doing it twice a week? Are you doing it every 2 weeks? Like I have a guy that, I don't give every 2 weeks that often, but he's like, I don't want to, like, I want to do injections. They make me feel great, but I don't want to jab myself in the leg, that many times in a month. So, all right, we got you on 2 weeks. We got your dose right. And there we are. I have another guy who He used to use a lot of anabolic steroids, and we've got him down to a really good level. He was infertile for a bit because of the testosterone, and now he has a child, and now he's going back on testosterone. But he wants to do, he's a guy that does it every single day. He does a micro dose every single day, right? Because that's what he feels comfortable, and that's where he feels the best. So we have guys that do micro doses, and then we have guys that do every 2 weeks, and there's a lot in between, and so I think that when you're doing it correctly, you're really meeting the patient and you're saying, all right, what's going to make you feel the best? What are you comfortable with? What's your, the right route of administration for you, right? Because for some guys, creams, I'm not a fan of creams, but for creams, they don't absorb as well with some guys. Even if you're lathering it on, they just don't get the right level. So that's not the right formulation for them. So it's a little more complex than just giving the same dose to everyone, the same exact dose to everyone that comes in the door. I think that's a little too simplistic.
Yeah, I totally agree. And I like the idea also of just, the research that I've been doing on this. I'm in Canada. I know you're in New York, Philadelphia area, but it sounds like the US is far more advanced in the options and the way to attack this challenge than we are here in Canada. We still seem to be pretty locked in to go in and get your monthly shot or your weekly shot or whatever it is. We do creams, but we're not as it's not as popular. And so what I like that I'm hearing is that, and hoping that when we get this thing out there, that there's some folks up here listen to this, because it sounds like we're really behind. I don't know if you're finding that in all of your work and your research. Are you finding that maybe the US is a little bit further advanced than some other places?
I think that, testosterone therapy, I think the laws are a little different. So I think that we can probably there's a lot of pop-up testosterone clinics which may not be readily available or legal in other countries. I think that we use a lot of things that are off label that I think a lot of other countries don't use, or that maybe they don't have access to them. So, it's really hard to put my finger on, but I think, I have Canadian urologists that I'm really good friends with, and they're really smart people, but I just don't think they have like all the tools that we have, and so I think that's really what it boils down to.
That makes complete sense. Absolutely. There must be at some point too, and through your investigation, that lifestyle is playing a factor in all of these things that we've been talking about today. Whether it's diet and exercise, and this may sound like a no-brainer that if we just ate right and exercise, that life would be better. But really, is our lifestyle truly affecting? As we change that lifestyle, are we going to really see that much of a change in our performance?
Oh yeah, definitely. I think we know that if you have a good diet, if you exercise, then you're less likely to have erectile dysfunction. You're less likely to have lower testosterone, which can translate into lower libido, right? Which can translate into depression, fatigue, all these things. There's not, the natural cure for a number of things. It's not a cure, but a natural kind of way to fight these diseases off is really it's exercise and having a good diet. That is really the essential of treating erectile function. It's hard to treat someone with ED if they have a really bad diet, say they're diabetic and they're not controlling their sugars, right? Or if they're a hypertensive because maybe they're obese, then they became hypertensive and they're not exercising. These are all things that are just beating your penis up. It's just whipping it, And so if you're exercising, you're doing all the things, then these things are going to become less likely. It's not going to totally negate things, but it's going to become less likely. And if you want improvement with your physician, if you're doing these things to help, then you're going to get to a better place at the end, right? And so exercise, diet, key things to do. I can't emphasize that enough.
Yeah, for sure. I'm not surprised to hear that, and it makes complete sense. I know there's lots of advancements now for guys in dealing with ED and lots of the stuff that we're talking about today. And probably the most extreme one is surgery, I would suggest. But there are other things that we can do. And I know one of the things in your clinic that you're really known for is this shockwave type therapy. Talk a little bit about some of the advances that you're seeing, the shockwave treatment, and other things that you're doing to help men work with this.
Yeah, so as I mentioned before, the cause of ED for a number of men is vascular, meaning that not getting enough blood flow to the penis. And a number of things that we do in the office can aid that and providing new blood vessels, providing something like nitric oxide, which helps to dilate the penis and increase blood flow. One of the things that we do in the office is core wave therapy. Core wave therapy is focused. And when I say focus, there's a difference between radial and focused, low intensity shockwave therapy. What this does is over a number of treatments, it helps with something called neo, meaning new, vascularization, meaning blood vessel formation. So it helps to increase blood vessel formation. It helps to increase nitric oxide. In rat studies, when you look at rats and you put shockwave, treat the rats' penises with shockwave, and then you amputate the penises and you look at those penises under a special microscope, you see new stem cell formation. So that study's not done in humans, but you can speculate, right?
Yeah.
So core wave therapy does all those things. We have special protocols in core wave therapy where we're treating men over a certain period of time with certain energy, right? And we have a special way of setting our patients up. So all of the core wave providers, they use our protocol, they use the focus shockwave therapy, and our success rates are great. You know, we usually can get a guy that maybe who's been on Viagra and Cialis, and we can get them to start using this Viagra and Cialis again. If we're trying to get a guy that, you know, is thinking about using Viagra and Cialis because their erections aren't there, you know, obviously we're using the exercise or pump, like that's a mainstay, but then we're using the core wave therapy along with it. And there's other things that we also use. We use Botox. We use a lot of Botox off label, not FDA approved. We use a lot of Botox for the penis as well, which helps. We use PRP for the penis. And we have and we also have some other, regiments that we use and protocols that we use to maximize a guy's erection potential. So there's a number of things that we use, but those are some things I'd like to highlight.
That's excellent. And lots of different ways to approach it. Lots of different ways because different things work for different people. And so it sounds like you've got a nice basket there of things for us to try. You know, through your career, I'm sure you've had some people, mentors, I would say, that, you know, have helped you along. What would you say was the best piece of advice you've received, and how are you still using that today?
So I've had a lot of mentors in my life, and you know, it's not all medical. Some of them are in athletics and all these other things. But I think one of and I think they all kind of say the same thing, sort of, is like you never stop learning, right? I think that you can't stop learning. You always have to continually read. You have to try to be up to date with the literature as well as start thinking ahead. You got to think ahead, right? We started doing like core wave therapy before hardly anyone in the United States was doing shockwave therapy. We started using Botox hardly before anybody was using Botox. You know, these are all the things that we've been doing. And so I think that the learning process should never end as a clinician or whatever you do, right? You have to enjoy what you're doing, right? But I think that's the biggest advice that I've gotten from my mentors in the past is that the learning process never ends. And there's no such thing as like a stupid idea. Like, you know, when these things came up, they're like, oh, why would you use it for that? Well, all right, let's think about it. Let's think if it makes sense. And if it makes sense, then let's try it safely, right? We don't go and do crazy things, but if it makes sense, let's try it. Let's try to do it safely in a small control setting. If it works, then let's bring it to the world.
Love that. Love that. That's really great mentoring there to have for yourself and giving for us as a reminder. So I appreciate that. Dr. Gittens, of everything that we spoke about today, maybe there's something we didn't get a chance to touch on. If there was a takeaway you'd want our listeners to have, what would that be? I
would just say that if you're suffering with any number of these sexual problems, I mean, we talked about, you know, premature or rapid ejaculation, we talked about ED, we talked about low libido and low testosterone. There's also guys that can ejaculate. There's guys that have pain when they ejaculate. There's guys that have chronic prostate pain, which is probably pelvic floor dysfunction. You know, whatever the issue is like, I would say if it's bothering you to really reach out for help. Right. And and you may not get the help, after finding, the first or second or third clinician, but just keep trying, and you're going to eventually find someone, and that's going to be able to help you.
Yeah, I love that. Absolutely. We need to do that. We need to keep trying and keep going until we have that person we can be comfortable with, and we can build that relationship, and they're willing to spend the time. And that's what it sounds like that you do in your practice. So I really appreciate you're doing that for men, because we are challenged in being able to speak about that. So thank you so much for doing that. And thank you for spending time with us today and showing us that we don't need to be afraid about faltering in the bedroom, that instead, if we just focus on taking charge of our bodies, and we can really take control of whether the things that we thought that we lost. And so if men are interested in getting a hold of you and participating in your work, what would be the best way for them to do that?
Yeah, so they can find me on Instagram at Dr. Gittens. My website is rockwellcenters.com. That's rockwellcenters with an S.com. If they're interested in the exerciser, that's one of the things that it has their own website, is exerciser.com. And I think we have like a discount code for people that want to get it. It's Gittens 20. They can use that to get a little discount and try things out at a cheaper cost, just for your listeners and everything. So,
Right.
So those are some things that how they can reach out to me. But if not me, I'd love to see everyone in Canada, But if not me, then find someone, like you said. Like I think you really drove home on that and said, like, find someone that's going to listen to you, that's going to take you seriously, that's going to give you more than just 5 minutes or so to really address your problems.
Yeah, absolutely. And I know there's more out there. And if not, we're going to make sure that all your information's in today's show notes so folks can get a hold of you. I really appreciate having you on the show and the conversation. Thank you so much.
Yeah, thanks for having me. It was a lot of fun.
Thank you for listening to the Revolutionary Man podcast. Are you ready to own your destiny? To become more the man you are destined to be? Join the brotherhood that is The Awakened Man at theawakenedman.net and start forging a new destiny today.